I want to apologize to the next speaker, who is the last speaker of the day, because he's been waiting for some time. And I'll speak of something very interesting, accessibility to information in terms of health, how we people learn about health, the famous fake news. A few years ago, Carlos Mateos spoke of health without any fake stories, to learn about what is happening in the world of research, in the world of medicine, avoiding the vested questions and news that were fake. When something happens in our health and when it affects our life, the more we hang on to any hope that we are given. We don't stop and think. We want to find a solution. Salud sin Bulos is doing a great job. I want to greet Ricardo Mariscal, responsible for institutional relations in Salud sin Bulos. Welcome, and apologize. I apologize for the delay. You know how things go. Okay, I will. I believe you have a presentation to speak to the audience. I have two goals: to show why it's important to know this information and to know about it. It's very important to know about it and show that we all have a role here. We all have a role in fighting against this disinformation in health and osteoarthritis. Firstly, with Ukraine, the Ukrainian war, economic recession, many will ask what's happening.
Compared with the war, with the increase in prices, maybe, this fake news in health is not innocuous. It's important because it has to do with the way we live, our quality of life, and sometimes it has really bad consequences. If we focus on the most severe things that can reach with the fake news in health is death. And these are two examples, recent examples, of two cases in which people ended up dying. In the first case, a person who was being advised by a guru and stopped taking his medication and died. And in the other case, we got the use of industrial bleach. Many people say this heals it all. Many therapists, pseudo-therapists, said during the pandemic that they could cure everything with it, with this bleach. There's also chloride dioxide, and it can kill us. So what are the main dangers of these fake news? Death is fatal, but it also has to do with treatments. If we abandon a treatment that works, your quality of life will be affected. Also, with the lack of prestige, many of those who create this fake news tend to damage professionals, brands, false alarms, people or institutions that disseminate fake news, or the so-called pseudo-therapists to create false alarms. What for? To create emergency, to have notoriety, or to sell their miraculous product. And as I said, the pseudotherapies that are everywhere. Lastly, confusion. This confusion is because patients, citizens, don't know what's true, what is not. You're being flooded with health news. In the pandemic, there was a term that came up, which was infodemia. A lot of information everywhere. It's a different type of pandemic. But in this situation, there's plenty fake news. They propagate. They become viral. That's why it's difficult to distinguish them from true information. Recently, we conducted several studies with patients, healthcare professionals, asking them about information and disinformation, and we draw very interesting conclusions. Asking them about fake news in health, they said how much they looked for information on the internet, how often they did so, And on what kind of websites or platforms did they look that information for? Some scientific sites, but also general media and forums. We also asked them if they went to the clinic having looked for information on the internet. That is, if they went to see the doctor with written information about their area of interest or treatments. And most would say yes, 8 out of 10. The problem was not only this, it's not bad to look for information on the internet. The problem, as I say, is where that information is looked for. And sometimes it was the case that patients reached the clinic and they confronted the doctor. They trusted more what they saw on the internet than what their doctor was saying. It tends to happen that the patient sometimes loses the trust in their doctor because of what they found on the internet, on Dr. Google, as we call it. So how does this fake news reach them? We said so in the survey earlier. Where do they look for information? Well, on social media, they are a place where the fake news is abundant. There's a lot of fake news. WhatsApp, too. Our surveys show that WhatsApp is the main channel for the dissemination of fake news in health. And we think that may come from these who are pseudo-therapists, people with interests that cannot be confessed. But no, sometimes fake news come through our relatives, friends, who are resending an item which is fake news with a good intention, thinking it's good. They think they are helping us, but they are damaging us. This is another example of what I said earlier, the channels. This is Telegram. Telegram is infected following the pandemic of channels about negationists, anti-vaccines. There's a little bit of everything. This is an example, but there are thousands of them. Now I'm not as afraid, but at the beginning, when I started looking into it, I was really afraid of what the diseases, the treatments that had been invented, attacking the professionals. You really need to know what these people are saying, what these guys are saying, to use empirical evidence. So among those who live from fake news, this is an example. This is Josep Pamias in the area of Balaguer, Lleida. He's got an industry dedicated to selling pseudo-therapies, pseudo-treatments, and fake news. He says that with his plants, with his bleach, he can cure many diseases. It's not true. It's dangerous, actually. In November, he organized a congress. It's called a Health Congress. They say that we are affecting their freedom of speech by saying that these are lies. And then, what thing influence in the viralization of these fake news? Well, Dr. Wills, we do a search of osteoporosis, osteoarthritis, and the first thing we find on following the search is not truthful information. It's that information of who paid Google to be first in the list. We need to consider this. This is what happened with Dr. Yahoo too. And then there's a phenomenon that we need to know, which is called clickbait. Clickbait is how many media are online are financing themselves. And until the crisis in the traditional media, there was no advertising. It didn't get there, and they started with clickbait. And this means that when you look at a news item online, you click on it, it leads you to the media outlet, but also to advertising. One click equals money for advertisers, a way of funding themselves. But since they're interested in you clicking on the news article, they publish very alarming news, exaggerated news that are not true, and what they do is just share or spread fear. Another thing that influences in fake news is a so-called bias, the biases. This is very complex. It's very interesting, though. It's like our emotional baggage. It's full of prejudice, things that are part of the way we think, the way we relate with the world, things that affect us when relating to others. But sometimes they lead us to believe in fake news or in things that are not true. It's a paradigmatic joke. The daughter says to the father, "No, Daddy, this is fake news." And the daddy says, "But, daughter, how can this be fake if this news says exactly what I think?" That's a clear bias. And we then have the influence from celebrities. You all know Miguel Bosé, but there are many others like him. People who have lack of information and speak of things they do not control, they do not know because they're not healthcare professionals, they don't have scientific knowledge, they make mistakes, and they love people to follow them. People believing them when they don't even know what they say. Bosé doesn't know what he says. And this is another media outlet. Media of lack of information has been harming us for many years. It's not being published on paper, it's only being published online. So we've seen really crazy things published in this magazine online. And then we got many other celebrities that have contributed willingly to disseminate health fake news. Gwyneth Paltrow has an industry dedicated to alternative miraculous treatments that are useless. It's been demonstrated. But what happens with the fake news on osteoporosis or osteoarthritis? There are many. Yes, there are myths that go from generation to generation. This is not fake news that someone generates out of the blue, but false beliefs that have been circulated for some time, but they also lead to lack of information. Misinformation. This is an example talking about beer and how it could favor the mineralization of bones. There had been a study, and then it referred to as in a headline. We could see the headlines of the news. And another fake news that we've seen recently about osteoarthritis is the miraculous cream. A miraculous cream which was said cured the joints, cured rheuma and pain. And it didn't have any scientific basis. But some media outlets believed in it. We need to dismantle that, deny it. And that's what we do at Salud y Bulos. They referred to these things as illnesses and diseases, but we're talking about more than 200. They also spoke about the good cause, a unique cause, saying that with this cream they could cure many things. Not true. They also spoke about chondroprotectors as a magic term to demonstrate the active principle, and don't know. What else can I say? What other fake news can I refer to? Miraculous products, machinery that they invent, things they invent for arthritis, osteoarthritis. Many people live from this. Many people make a living of this. They ask you to take infusions without any scientific backing. And they lead people away from the treatment that works or from listening to the experts and doctors. These are just testimonials. This is what you see on the right, an invented testimonial. So let's see what can be done, okay? It is clear that this has consequences. Fake news has consequences for our health. So can we do something as citizens? The healthcare professionals have the scientific evidence, but patients and citizens can do something too. What they receive via WhatsApp, for instance, they can analyze it very briefly, critically. They can see if this has been published by a known or renowned media, whether it's anonymous. They can see the content to see whether it can be replied by means of another media or if there is intentionality. Broadly speaking, in some fake news, they invent the names of positions, hospitals, doctors. That is also the case. Anybody can do this with internet right now. These are questions you can ask yourselves. Is the author a journalist? Is the intention inform, share an opinion, just entertain? And then content, to compare, to contrast, whether other media outlets have published that information, and if they haven't, it could be suspectful of fake news. What else can we do to discover if information about osteoarthritis is fake news and not genuine? Well, we need healthcare professionals. Some may also invent fake news too. That can happen too. Then quoted phase 3 studies. These are completed and contrasted studies. In recent times, the pandemic has seen many pre-trials, not peer-reviewed studies, so we need to consider them, but very carefully. They're based on real testimonials. They include invented content. They love to invent new words to convince us that there's a scientific evidence behind them, when it's actually the opposite. And then prescriptions, homemade prescriptions. It's very often for fake news on osteoporosis and osteoarthritis to come up with home remedies. It creates alarm. There's a lot of false alarm related to these fake news. Sometimes the aim is to frighten us to buy their miraculous project or to damage a third party. They try to sell something. Is the news updated? Sometimes the fake news repeat seasonally. Some are very old and they come back again and again. So this can be discovered. We can see if they're outdated or not. You can discover it quickly with Google. You look for it and you compare. Is there a context? Can it be recognized in that context? Are the images real? It's common to use images that are not consistent with the context that is being explained. And then, is the headline consistent with the text? In clickbaiting, they use exaggerated titles, headlines. Some of them are crazy, but it's just to raise raise attention. And then links that can be verified. You can read something on the media, on social media, and anybody can do these verifications. We all have internet. We all have access to the internet. And this is what I mentioned about preprints. These are studies that have not been completed and which have been trendy during the pandemic. And then Google. Google has a very free tool, Google Images. Google Images allows you to compare and verify if an image you received truly belongs to the context, the historical context of the place, of the date of the content referred to. You can put the address of the image or the image directly, and then you look for similar searches. And you will see if the images have shown in other places, you can verify that. Sometimes the image is very old and it's not consistent with what you're being told. This is a tool, a free tool, Google Images. You can easily use it. And then for social media, to discover the trolls and the bots, there's something which is the botometer. Botometer is a tool that provides you with a scale telling you whether that tweet is a tweet that corresponds to a troll or a campaign orchestrated to sell fake news. These are the trolls, and we need to be very careful with them in social media. People who look for notoriety, who are looking for just trouble, and just informing about fake news. And then sources. Where can we look for information about osteoporosis and osteoarthritis? Not on Google, not on Telegram, not on what your friends and relatives send you over WhatsApp. You need to contrast the information. This is from Salud sin Bulos, patient associations, scientific organizations. These are reliable sources that you can find on the internet, the Ministry of Health, also the blogs of healthcare professionals and the social media of these healthcare professionals and entities. They are also reliable sources, especially if they use scientific evidence. This is just an example of a decalogue we prepared. This is reliable. We prepared this report to inform about drugs because there were many influencers on fashion and beauty that recommended drugs for fashion when they had not been prescribed. It was dangerous. So we advise people how to use these things safely. And here are some reliable sources you can resort to: guides, textbooks, references for relatives, friends, patients. They provide advice and patterns to follow. This is where you need to find reliable information. These guides or the Osteoporosis Foundation. That is where resources can be found. Images, updated news, and not on social media of WhatsApp. Not in the media created by negationists or the anti-vaccine believers. And with this, we come to the end of my presentation. Thank you very much for your attention, and thank you all. It's been a pleasure to be here with you. Well, thank you very much to you. Thank you, Ricardo. I always thought that if there's any question, let's take advantage. We are in the final stretch. But I always like to say that when one leaves the clinic after visiting the doctor with a diagnosis, I think that the first thing 99.9% of the people do is go onto Google and to look for that pathology, to look at that term that was mentioned by the doctor because it might have not been all that clear following the conversation with the doctor. This, unfortunately, is quite common. They leave the clinic without having a clear idea of what happened. So, if we go to, let's say, a serious media outlet, a serious newspaper in the printed or online version, a radio station, a serious one, and by serious I mean those that have been working for many years, or television channels, can we trust them? Or even there, can we be given fake news? In those media outlets, they can also give you fake news because now they use clickbaiting. They take advantage of the immediacy of social media. And sometimes they do not do enough contrasting of the information. So sometimes traditional media also publishes fake news. You are part of ANIS, the National Association of Health Informers, and there are just few journalists specializing on health, right? Yes, less. There's less and less. Many media, many resources were swept after the pandemic, and now healthcare professionals and journalists complain they have no time to verify their information. Before it was much easier for them, but now with social media, they need to be the first to launch the news on Twitter, social media, and the internet. And this is a limiting factor. I would like to congratulate Sergio Alonso, Deputy Director of La Razón, for receiving the ANES Award 2022. Ricardo, we have Dr. Castañeda here from Lima, and he loves medicine. He loves to ask questions. He loves to take part. So, Osvaldo, the floor is yours.
No te encienden el micrófono.
I'm afraid your microphone is not on. Now it is, yes. First of all, it's been a great presentation. Thank you very much. I would just like to make one comment regarding chloride dioxide, which has to do with what we just heard. The other problem is ignorance and not being informed or reviewing what one learnt. When there was this absurd use of chloride dioxide, what did those promoting it said? They said that it accessed the blood and it transformed into oxygen that would reach the lung to oxygenate it, and the chloride would destroy the virus. This is absurd, because it doesn't make any sense. Chlorine dioxide is taken, and when it accesses the stomach, as everybody knows, the stomach has chlorhydric acid. So when one ingests chlorine dioxide, it turns into sodium hypochlorite, which is toxic. And at no point at all does it happen that the chlorine is separated from the oxygen in the blood. But some doctors said that, and people believed them. And it is not true. It was a terrible lie. In Peru, in a city to the south of Peru, the second city of Peru, Arequipa, there was a time then that 30% of those being admitted into hospital because of COVID had been using chlorine dioxide. Several died along the way because of it. Thank you, Dr. Castañeda. There is still a lot to be done, Ricardo. We could organize a Congress on health without fake news. You would have 24 hours, 7 days a week, and I'm sure you would find many. The important thing is for people to not believe the first thing that come their way, and especially to verify things, to verify news with the smart guys, to verify it with an association of patients, with a doctor, with people who are serious, trustworthy people. That's the minimum we can ask for. Dr. Vergés would like to greet you as well. Thank you, Ricardo. Next year you need to be here with us, by the way. Okay. Thank you. You know, it's a pleasure to cooperate, and we have an excellent cooperation with you. In osteoporosis and in osteoarthritis, it's amazing to see how many products are launched every day saying that this works. Sometimes they even do it really well. I was approached once, Dr. Guillen was approached once as well. In congresses or events, they approach you, and then they say one thing or the other. I lived this with Dr. Guillen. Yes, fake news is becoming professionalized, and they are doing it better and better. But it is clear, in OAFI and OAFI, we need to put a stop to this. We need to be very rigorous and very serious. So, health without fake news. Thank you so much, Ricardo.